Hector Cruz, Persuasive Speech. Heart disease is the leading cause of death in America. According to the CDC, 630,000 Americans will die from a heart attack each year. That's 1 in every 4 deaths in America. Now, there are 4 types of heart disease, of which coronary heart disease is the most common. Coronary heart disease in America killed approximately 366,000 Americans in the year of 2015. Now, here's a chilling fact. The CDC, Center for Disease Control, also states that in America, somebody will suffer from a heart attack and possibly die approximately every 40 seconds. There are 3 key risk factors to heart disease. That is high blood pressure, high cholesterol, and smoking. 49% of our population in America have at least one of these risks. Other medical conditions and lifestyles that can put you at risk are diabetes, obesity, poor diet, physical inactivity, and alcohol abuse. Now let's imagine this. Scenario number 1. John A. Doe runs marathons, is healthy, 45 years old, has a great diet, does not drink, does not smoke. One Sunday morning, suffers from a heart attack and dies. Scenario number 2. John B. Doe, 45 years old, severely overweight, drinks and abuse, smokes a lot, horrible diet. One Sunday morning, he wakes up, suffers from a heart attack, and dies. What's important here? We must know our family history. It is my hope to persuade the specific population to take action and change by discussing the lack of knowledge involved for primary and secondary conditions for the risk of heart attack. A problem. Lack of knowledge and awareness for primary and secondary conditions that increase the chances of a heart attack. Let's talk about inherited cardiac conditions, ICC. ICC, also known as genetic conditions, are something that are passed on from your parents. ICC is caused by a mutation in the genes. Anyone who has this mutation in the genes has a 50-50 chance of passing it on. Genes control every aspect of the cardiovascular system. Everything from the strength of the blood vessels to the way the heart cells communicate in the heart. A genetic mutation can change the way a particular function works in a heart. For example, the way it processes cholesterol, which it might do it differently, so it might do it so that it increases the chance of a blockage. Now let's talk about heart disease that are not inherited. And this would be known as heart disease behavior. And they are, number 1 would be smoking. What can smoking do? Smoking can damage the heart blood vessels, increase the chance of a heart attack. Nicotine can raise blood pressure. Carbon monoxide can decrease oxygen in the blood. Number 2, unhealthy diets. Diets that are high in trans fats. Diets that are high in saturated fats. These are all linked to hardening of the arteries. Physical inactivity. Physical inactivity can increase medical conditions that put you at risk, like obesity, high blood pressure, and high cholesterol. And then number 4 is too much alcohol. Drinking in excess of alcohol can raise your blood pressure levels and raise your triglyceride levels, which also puts you at risk of a heart attack. So now that we've discussed the awareness of the 2 potential problems for primary and secondary risk factors, let us discuss what we can do to improve the predictions and treatment in an attempt to avoid a life-threatening heart attack. A solution. Heart disease can be a genetic disorder. Genetic testing can be performed to see if one carries a gene. In addition, getting medical help early can help prevent heart disease from progressing or causing complications and manage symptoms. To date, researchers have discovered about 67 different sites in the DNA sequence that are called mutations. You can have one or more of these copies. Obviously, the more copies you have, the higher at risk you are for a heart attack. Different conditions require different interventions or treatment. They are lifestyle changes like weight loss and eating healthy, medications that regulate your heart function and rhythm, and reduce swelling, and even prevent blood clots. And then we have surgical or non-surgical procedures. Now, we have Dr. Cross, who is a volunteer for the American Heart Association, and he is quoted for saying, "You should share your family history with your healthcare providers as soon as possible." Dr. Cross also recommends a website created by the American Heart Association where the goal is to educate the public. And this website is called My Life Check, Life's Simple 7. In conclusion, we talked about the lack of knowledge and awareness for primary and secondary reasons that put you at risk for a heart attack. And then we discussed a solution, which is to take action and change. If a family member is diagnosed with some kind of cardiac condition, then it is recommended and encouraged that the other family members get screened in an attempt to avoid a life-threatening heart attack. Thank you.